Well, hello, and welcome to Talk About It Tuesday. I'm your host, Keith Taylor. Today we're talking to Dr. Helou. Hey, how you doing?
Good, how about you?
Good. So today we're going to be talking about what Dr. Helou does here at StayWell Health Center. So can you tell us what you do?
So I've been here since 2017, and I really like my job and my patient population, and we have a good support staff in terms of the medical assistants, the nurses, and the Ryan White team, the case managers, and you guys are an invaluable player in the team. My job here is mainly the infectious disease provider, so I treat patients who are HIV positive, I treat STDs, patients who have viral hepatitis, and we also have PrEP patients, so pre-exposure prophylaxis for patients who are HIV negative and are at high risk of getting HIV, including patients who inject drugs, or serodiscordant couples where one partner is HIV positive, the other partner is HIV negative, or anybody who is interested, who doesn't have a steady partner, or has gotten an STD, does qualify for this service.
Okay. So what made you decide to get into this field?
So I've been living in the United States since 2012. I did my residency training at Yale in New Haven. And I did a lot of research in the field of infectious diseases and HIV between 2012 and 2015, and it was very, a very passionate subject for me, and it involves, the body from head to toe. It can affect you in multiple different ways. So it was something very fascinating and interesting, in terms of different patient population, cis women, cis men, trans women, the LGBT population. So that was the reason why I decided to go into infectious diseases and HIV.
Okay. So tell us a little bit more about, what's it been like treating these patients, the hurdles or the struggles or the success?
Right, so, I've had a lot of patients who, are, always interested and involved in their care and with their health. They always come to their appointments every 3 months, every 6 months. They do their blood work on time, they take their medications, they're very compliant. But, that doesn't apply for everybody. So, there are a lot of hurdles or barriers, as you mentioned, especially during these difficult times with the COVID pandemic. But we've tried to adapt. We're offering telehealth services. We've tried to talk to patients on the phone with their FaceTime. And we're trying to see more patients in the office as people become vaccinated against COVID. So, there's a lot of comorbidities, social issues, in terms of, homelessness, behavioral health issues, substance abuse issues, and just, fatigue from taking pills. There's a lot of social stressors. So we offer a multidisciplinary approach in terms of, medical, case management, behavioral health, social support, and OBGYN, dental, nutritionist, bus passes, food cards. So we have a lot of resources for the patients.
Yeah, we do. So, and with the PrEP clients as well. So tell us what they would have to expect if they would like to be on PrEP.
So I would encourage, anybody who is in a serodiscordant couple or they don't know the status of their partner, first of all, to get tested and to think about PrEP, which is pre-exposure prophylaxis. Truvada and Descovy are the medications that are approved currently for prevention against HIV. We're always having new HIV diagnoses, even in 2021.
Yes, in 2021. We just had, 3?
Yeah, unfortunately, we've had 3 new diagnoses since the beginning of the year.
Yeah, unfortunately.
And, LGBT, people of color, women, so everybody is at risk. If you've had an STD, chlamydia, gonorrhea, syphilis, if you don't know the status of your partner, if your partner is HIV positive, not undetectable, or if you inject drugs, you might be eligible for this medication to prevent you from acquiring HIV. So the medication is best taken every day, once a day. There are minor side effects with the medications. There are assistance programs in order to be able to get the medication without paying out of pocket.
Yes.
And you're gonna get blood work before you start, and on average every 3 to 6 months.
So that's what we were talking about today, being HIV positive and what it's like seeing the doctor, as well as getting on PrEP and what to be expected taking PrEP. So until next time, you have a good day, and don't forget to talk about it. Bye-bye.